Health equity means to me that everybody has access to a better quality of life, despite their background, whether it has to do with socioeconomic class, gender, race, and all the other social identities. And it also means that everybody has the opportunity to reach their full potential of well health.
When I first heard health equity, I feel that it was a huge concept because I easily relate it to public health campaign or government policy which aim to ensure that everyone has the right to healthcare. But then I think about it again and zoomed in, tried to look close at it and place it to my own research context. For example, when we help chronic heart failure patients with multiple chronic conditions, health equity doesn't just mean give all the patients the same treatment, but rather consider the patient's preferences, goals, and values, and try to address the questions that matter most to them.
I worked with the UW School of Medicine and Public Health. We partnered with 4 communities in Wisconsin to address the black-white gap in infant mortality. In Wisconsin, black babies are 3 times more likely to die before their first birthday compared to white babies. We learned a lot about what health equity is, what health equity looks like, and what it means to partner with communities to achieve health equity. Some of the things we learned were about honoring and respecting Indigenous voices, having Indigenous voices lead and guide the work. We also learned what it meant to stay in our lane and to appropriately apply our expertise as we partnered with communities to address a really important issue.
I have worked with patients that lack healthcare insurance, lack any sort of health literacy, and populations that might be underserved when it comes to healthcare access. And this experience comes from my student nurse clinical experience here at UW and working as a CNA at the Veterans Hospital in Madison.
What motivates me is when I was growing up, I had my parents actually immigrated here in the U.S. 20 years ago, and basically they had gone through a multitude of barriers against the healthcare system, which means that they had a language barrier and a knowledge barrier of how the healthcare system works in the U.S. So growing up, I was kind of their medical language translator, where I would teach the medical terminology, whether it be going through insurance plans or finding different doctors, and kind of just helping them bridge that gap between healthcare and them. So as I went to these places, these healthcare places, I saw lots of people like my parents who didn't understand the healthcare system quite as well as other people did. So for me, that's what motivates me. It's just the fact of going through the experiences that I have had and really using my experiences in a space where I feel like it's needed.
Health equity is not that far away from our daily life. As healthcare providers, we can really zoom in and get a close look at it and place it in our own daily context so that we can provide health equity to the patients through our contribution and efforts.